Working in this space and understanding that there are continuing to be more of these specialty drugs coming to market, we need to find the best way to get that medicine to our patients.
The pediatric landscape changes very rapidly, and so does the healthcare that has to go along with that.
We're thinking about those patients often in a chronic care model and requiring medications over a long period, potentially over their lifetime. The challenges around some of these specialty medications are both access, availability, time to receiving the medications, and certainly the cost around some of these therapies.
One of the biggest obstacles we had was coordinating the physicians knowing exactly what was going on with their patient.
The collaboration with Shields has allowed us to really integrate the process of getting these children and their families the medicines that they need.
They were traditionally going to outside pharmacies where they would just call a number, they wouldn't have a dedicated staff. One of the biggest obstacles we had was coordinating the physicians knowing exactly what was going on with their patient. The partnership between Shields and Phoenix Children's has really helped with the day-to-day operations of what we do here.
It's improved satisfaction for providers and caregivers in that it's really allowed them to focus on treating the patients and removing a lot of the barriers and a lot of the back office work that oftentimes goes to trying to coordinate connectivity with payers and outside specialty pharmacies.
Having it here integrated into the hospital made it so that we meet with the staff, we find out what their workflows are, where we can do the best things possible for them in the least invasive ways. And Shields has helped us decide where we need to fit in. It's a coordination of care between the physicians, MAs, nurses, and then our staff, our liaisons, and our pharmacy team downstairs.
The value that we see from our specialty pharmacy is primarily related to clinical outcomes. For example, within our cystic fibrosis population, we've seen significant improvement compared to the industry standard. They have almost a 30% increase in medication adherence compared to other markets, but they also have a reduced burden of their disease.
For us, it's supporting our mission, which is the hope, healing, and best healthcare we can get for our patients and their families. And some of those things are the patient assistance program for their financial aid. We've done over $2.2 million in the past year and a half, which we've been able to support the family so they can get the necessary medications that they need on time and for a much reduced price.
I enjoy coming to work every day to be able to resolve my patients' issues and concerns. I want to be able to make sure that they are living their best life. And going home every day knowing that I was able to play a part in that is fulfilling to me.